great to see so many staff here, doctors, nurses, and even some of the public. It's wonderful. The Joseph Brant Hospital is very important to our community. While I'm the one at the podium, I'm speaking on behalf of my parents and my brothers. I'm extremely honored and proud to be representing all the Paletta family here today. The reason we're able to make this donation is because of two special people. Pasquale and Anita Paletta came to Burlington in 1964 to start their family and their business. Our father is a man of great ambition, pride, integrity, and drive at the highest level. He's a man who lives by his word, performance, results, and loyalty. He's a true leader and leads by example, who's never been afraid to get in the trenches to do what needs to be done to deliver what he promised. Yet, he's a man of great humility, humble, salt of the earth, and a respectful individual. A family man, a loving and caring man who loves his family more than anything, and a man who also loves his community. He's always stayed in the background, running his business and not looking for any notoriety or kudos. He who truly believes and has taught his four sons that giving back to the community is extremely important. Ladies and gentlemen, please recognize our founder, our patriarch, leader, and mentor, and most importantly, our father, Pasquale Paletta. The second person, and of equal importance, is our mother, Anita Paletta. Anita stood by Anita stood by our father's side from day one, working full-time in the business, managing the office and the accounting books. This is the person who has loved and looked after her husband each and every day, which I tell you is no easy task. Over and above this, she ran the entire household, raised and cared for four rambunctious, mischievous, hard-headed sons, and still to this day continues to do so. Honestly, I think she has the much tougher job. Ladies and gentlemen, please recognize our second in command, our matriarch and our mother, Anita Paletta. Lastly, my three brothers, Ramy, Paul, and Michael. We have been growing up and working in the family business since we were able to walk and talk. We work weekends and school holidays, and all four of us are still in school today, attending the University of Pat Paletta. None of us ever think we're going to graduate. We have a very tough prof. We listen to our parents most of the time. We've learned from them. We have followed their guidance in taking on their beliefs in pride, honor, integrity, and giving back to the community. Each and every day we strive to make the family and business bigger and better. Most importantly, we try to make our parents proud of their four sons. Ladies and gentlemen, my brothers Ramy, Paul, and Michael Paletta. This gift today is the largest gift that I know of in the 250-year history of the Paletta family name. However, to decide to give this donation to Joseph Brant Hospital was no easy task. We were approached a number of times over the past 5 years to donate to the campaign. Based on our past experiences with the hospital and being performance and results driven, it just didn't feel right. The hours and hours of wait time in the emergency department, the look and feel of the facility, and unfortunately the poor morale of staff just didn't meet our expectations. Well, that has changed. Change is coming and change is happening. The hospital is on a new path, a new direction, with a new efficient facility and more modern equipment. My brothers and I met with Eric, Wes, your chief of staff, Kevin, Brady, and Anita. We wanted to know firsthand what was happening, and we wanted the corporate and personal commitment from all of them to the change, to physically see and hear the plans and programs in place to make the hospital better. Eric and Wes explained the new lean program, as well as the Kaisers that have taken place between management and staff jointly. Eric and Wes advised us that change was happening. Staff morale was getting better, shorter wait times in emergency, and better things still to come. In addition, myself and my brothers were given a tour of the mock-up rooms for the different departments for the new hospital. These new rooms will be tremendous. There'll be more private rooms with better layouts and more up-to-date equipment for staff to better care and manage the patients. If you have not seen these new rooms, I strongly suggest you go and take a tour. It definitely helped us in our decision-making process. The Lean program is working, staff is engaged, and is encouraged to make suggestions. Who better to ask than those on the floor actually doing the work? Not too long ago, the family needed the use of the ICU department. When visiting the department over a few days, I saw how poor the rooms were. But I noticed the board in the hallway that had multiple green sticky notes, suggestions by staff on changes to procedures, use of equipment, or supplies. There's also notes from management indicating those suggestions being implemented and those still being reviewed. Staff and management are listening to each other, and staff morale is definitely improving. Having seen firsthand the existing rooms, and to see what is to come, and the fact that staff and management are finally working together to give better patient care guided us further in our decision to help. The family sends its thanks and appreciation to Eric, Wes, Kevin, and Anita, and all their staff for the hard work and long hours spent on achieving the goal for a new hospital for this community. It has been no easy task. Just dealing with me, I'm sure, has created a lot of anxiety for them. The family is also proud to join the group of leaders who have also set examples with their donation dollars in this community. Michael Lee Chin, David Braley, Ron Joyce, the Molinaro family, and many others. Thank you for your generous contributions. Ladies and gentlemen, this is a matched donation program. Let's be realistic. No one wants to come to the hospital for a vacation, even for a few days. We come because we need help. We want shorter wait times, pleasant staff, and a decent room. We want to feel better as quickly as possible. Deep down inside and in the back of our minds, we want to know that if we need the hospital for ourselves or a loved one, the facility, the equipment, and the staff are there, ready, willing, and able. The only way to make that happen is to give. The existing Joseph Brant Hospital is simply too old. It is outdated and is not expanded, nor kept up with the growth of our city. The community is also aging. We need a better hospital close to home. Now is the time we need to provide the community with the best hospital, with the best facility, with the best equipment for doctors, nurses, and staff to do their job, and the best environment for them to work in. Without these tools and workplace environment, they just can't do it. The exciting thing is that the doctors, nurses, and staff really want to help. They want to make us better. I have seen it and I have heard it. Last week, I spoke with two team leaders, Ashley in ICU and Sarah in emergency. Ashley's been at the hospital for 8 years and Sarah for 13. I wanted to know if what Eric and Wes were telling us was being applied and accepted by staff. Both of them are bubbling with anticipation for the completion of the new hospital and the changes that have already taken place. Both expressed with large smiles and vigor how the culture has changed for the better. They stated there is more collaboration with the departments and more collaboration with management. Morale is much higher. They all want patients and families to see this collaboration. They told me they find it very rewarding to staff for families to see them working together. They want more patient and family engagement. Both honestly believe that with the new facility and programs that this will happen. They were extremely excited about the project and with the enhancements it will bring, and ultimately to better patient care. We would not be putting our dollars here if change wasn't happening. Ladies and gentlemen, I'm telling you firsthand that there is change for the better, and through this donation, it will continue. I humbly ask the entire Burlington community for your help. Any amount will be accepted. We will match dollar for dollar your donation. Tell your family, friends, and neighbors to contribute. It doesn't matter if it's $1 or $10 or $100 or thousands of dollars. We will match it. We are on the final stretch of this fundraising campaign. We have $10 million to go. The Pasquale and Anita Paletta Family Match Program has contributed 50%. We are already halfway there. Please help us to help you, help your family, your friends and neighbors to get us to the finish line. I know management will appreciate it. I know more importantly, the doctors, nurses, and staff will appreciate it. Of course, ultimately, we, the community, benefit from it. Let's give them the opportunity, the facility, and the tools to make it happen. Please join the Pasquale and Anita Paletta Family Match Program. Let's join the J today. Thank you.